Hi, today's topic is going to be on diarrhea. Let us first start by defining diarrhea. And diarrhea is the word we use to describe frequent and loose and watery stools occurring about 2 to 3 or more times per day. If it lasts for more than 2 weeks, we call it chronic diarrhea. If it lasts for less than 2 weeks, we call it acute diarrhea. Now, diarrhea is the leading cause of death among children in low to middle income countries. And most of these deaths occur because of fluid loss and dehydration. In fact, about 1.8 million children die from diarrheal diseases every year. And most of these deaths could be prevented if these children had proper access to clean drinking water and proper sanitary conditions. Now, diarrhea can be divided into two groups. We have non-inflammatory diarrhea and we have inflammatory diarrhea. Non-inflammatory diarrhea is a milder disease and is usually caused by viruses, although bacteria and parasites can cause it as well. This type of diarrhea will present with large watery stools with some nausea, some vomiting, abdominal cramping, and on a few occasions with fever as well. Because the bacteria, the germs that cause this type of diarrhea do not invade the bowel wall, they do not cause blood in the stool. And so doctors will not find white blood cells in the stool, and they wouldn't find blood in the stool when they examine the stool of a patient with this type of diarrhea. On the other hand, inflammatory diarrhea is a more serious disease. It's more severe. And in this case, patients have pain, abdominal pain, there's blood in the stool, they more frequently have fevers, and they suffer from straining called tenesmus. The types of bacteria that can cause this type of diarrhea are Salmonella, Shigella, Campylobacter, certain types of E. coli. So, what are some of the types of diarrhea that we encounter and that we suffer from? Well, the most common cause of diarrhea is infection. And most of the germs that cause diarrheal illnesses live in the bowel of infected people and in the bowels of animals. So for us to become sick, for us to become infected ourselves, we have to come into contact with the feces of animals or people that have these germs in them. So, for example, if we went to a petting zoo and we petted the animals, or we went to the petting zoo and we were touching the rails and other objects in the environment that are contaminated with the feces from the animals, we can contract these bacteria and germs and catch these illnesses. In the case of people, we come into contact with feces from people, small particles of feces, without even knowing it. People go to the restroom, they use the toilet without washing their hands after, or people prepare food with soiled hands. When people clean children with rags and do not wash their hands after they change diapers, that too can soil their hands. And then we come into contact with them, or they prepare food and without washing their hands, and that can cause us to contract the germs and catch diarrheal illnesses. Contamination of surfaces, they touch the surfaces around us and then we touch those surfaces and we can contract those germs like that. Poor supply of clean water, poor sanitary conditions in low to middle income countries. These are the ways these germs spread. Not to mention the fact that in some areas, some very severely poor areas, people share the same sources of water, and when the animals defecate in the water, people use that water for washing and cooking and drinking, and obviously that can lead to infection of those people. Now, what are some of the causes, the more frequent causes of diarrheal illnesses? And as I mentioned before, the most common cause is, in fact, infection. And some of the infectious agents that can cause diarrheal illnesses are bacteria such as Salmonella and Shigella. And I mentioned E. coli and Campylobacter. But viruses as well can cause diarrheal illnesses. As a matter of fact, virus illnesses and virus diarrheal illnesses are probably the most common form of diarrheal illness that we. And rotaviruses are commonly seen in daycare centers among children. Noroviruses occur very frequently in institutional settings such as university dorms, college dorms, army barracks, etc. Now, this virus spreads from person to person because of the close contact that exists in institutions like that, and people inadvertently ingest fecal particles containing these viruses when they touch contaminated surfaces, or they come into contact with people who are infected and who do not practice proper hygiene. Certain foods can spread diarrheal illnesses. Let us go back to the infectious causes of diarrheal illnesses, because parasites are also a cause of diarrheal illness. And two of the more common parasites that we encounter are Giardia and Cryptosporidium. And Giardia and Cryptosporidium are hardy. They're resistant to proper chlorination. So in our drinking water, we can find Giardia and Cryptosporidium if the drinking water is not properly treated. In many recreational bodies of water, such as swimming pools, ponds, lakes, and streams where people bathe for recreation, these can become infested with Cryptosporidium and Giardia, and people can ingest them when they bathe and swim in those bodies of water, or when they ingest or inhale the fine particles that are generated through splashing and become infected by that route. So Giardia and Cryptosporidium are common, and even though you may go to a swimming pool that is well chlorinated, you can still catch Giardia and Cryptosporidium. In low-income parts of the world, amoeba are a major threat for diarrheal illnesses. And Entamoeba histolytica is probably the leading cause of protozoan death after malaria. In fact, it causes about 100,000 deaths every year. And Entamoeba histolytica is also a cause of abscesses in the liver, and in some cases it is fatal. As I mentioned, 100,000 deaths a year. Now, what about foods? Some foods cause diarrhea by spreading these infections. And for example, we mentioned dirty hands and preparing food. When people prepare food with dirty hands, they can contaminate the food and spread these germs to unsuspecting consumers of the food. Traveler's diarrhea is commonly caused like this, and traveler's diarrhea is usually caused by bacteria such as E. coli. And traveler's diarrhea is most commonly contracted when you consume food from road stands and street vendors who do not follow proper hygienic practices, or who do not cook the food properly, or if they leave the food out in the open without warming it or keeping it warm, or allow flies to fester on the food, these can contaminate the food and lead to diarrheal illnesses. Food can also cause diarrheal illnesses and spread by spreading germs when we do not cook foods properly. For instance, some people consume fish and shellfish in the raw, and those can harbor Vibrio bacteria, which can cause diarrheal illnesses such as cholera. Vibrio cholerae is the bacterium that causes the cholera illness. And in other cases, poorly cooked beef, poorly cooked pork, poorly cooked poultry can spread staphylococcus or salmonella. Eggs are very frequently cause salmonella illnesses, so we must be extremely vigilant when we consume eggs and make sure that they're not raw eggs that we consume. Medications can cause diarrheal illness, and antibiotics frequently cause diarrheal illnesses in patients that consume them, that take them. Any antibiotic can cause diarrheal illnesses, especially if they disturb the fine, delicate balance that exists in the bowel between the normal flora of the bowel and the disease-causing bacteria that we find in the environment. If the antibiotic damages and destroys the normal flora, then those pathogenic disease-causing disease-causing bacteria and germs can grow in the bowel and lead to diarrheal illnesses. Now, some germs are found in water, so when we travel to less developed countries and we consume the water, we should make sure that the water is at least boiled, but preferably bottled water, and we should make sure that the fruit and vegetables are not washed with contaminated water. At least have the fruit peeled. You peel it yourself. And even ice, when we are consuming ice, the ice can carry bacteria, because if they make the ice with contaminated water, then it will contain these germs that can cause diarrheal illnesses. Food can also cause diarrheal illness directly. And for instance, when people consume spicy foods can irritate the lining of the bowel and lead to diarrheal illness. Some people who eat chilies, or people who eat certain blends of curry, can have diarrheal illness as a result of this irritation. Alcohol causes diarrhea in some people, as does coffee, especially if people consume too much coffee. 2 to 3 or more cups of coffee a day frequently causes diarrheal illness in people. Certain vegetables, cruciferous vegetables like cabbage and broccoli, have molecules in them that our body has difficulty digesting, and this can lead to diarrheal illness if we consume those foods in large amounts and in the fresh, uncooked form. Other vegetables and seasonings such as garlic and onion also contain molecules that can lead to diarrheal illness. Greasy, fatty food, such as fast food, is difficult for us to digest, and that can cause diarrheal illnesses as well. Malabsorption, which is the inability of the body to absorb the nutrients that are produced after digestion is also a source of diarrheal illness. And one of the most common forms of malabsorption that we encounter is celiac disease, which is a hypersensitivity to gluten, the protein that we find in wheat and other grains. So people with celiac disease usually present and complain of chronic diarrheal illnesses. Acute abdominal illnesses such as poor circulation to the bowel wall can also lead to diarrheal illness, as can certain types of gastrointestinal diseases like inflammatory bowel disease or Crohn's disease. In these conditions, the immune system is attacking the tissue of the bowel, damaging that tissue, which leads to diarrhea. People with diseases that compromise the immune system, or who are taking medications that suppress the immune system, such as cancer drugs, or the people with HIV who have a deficiency of the immune system, can also develop infections of the bowel, commonly with Giardia and Cryptosporidium, that can lead to diarrheal illnesses. We also have hereditary forms of diarrheal illness, such as lactase deficiency. Lactase is that is that enzyme that the body uses to break down lactose, which is the sugar that is found in milk and dairy products. So persons who have that deficiency, which is a hereditary condition, will develop diarrhea when they consume dairy products. Other types of hereditary diarrheal illness include the immunoglobulin A deficiency. Immunoglobulins, as we know, are antibodies that protect us from infection. And the antibody, immunoglobulin A, usually protects the lining of the bowel from infectious diseases. And when there's a deficiency or a low count of these antibodies, bacteria and germs can grow in the bowel, and that growth can lead to diarrheal illness. Certain glandular types of illnesses can cause diarrhea in people. For example, an overactive thyroid can lead to diarrheal illness because the high thyroid hormone level in the blood causes irritability and increases the motility of the bowel wall. In some cases, the body is not producing enough enzymes to digest the food that we eat. For example, in chronic pancreatitis, the pancreas is the gland in the body that makes those enzymes that we use to digest the food that we eat. And when the pancreas is damaged and there is an inefficiency, there is a insufficiency of the pancreas, and there's a decrease in the number or the amount of enzymes that the pancreas is making, our body is not able to digest those foods, and it can lead to diarrheal illness. Some forms of cancers produce hormones that stimulate the bowel wall and cause diarrheal illness. And finally, people who have cancers that require radiation can develop diarrheal illness if we radiate the abdominal cavity or the pelvic cavity, because during the radiation of cancers in those areas, inadvertently the radiation also damages the wall of the bowel, and this damage to the bowel wall can cause diarrhea that sometimes resolves pretty quickly within a few days, and in other cases it can be chronic and severe. I hope this talk has provided you with an overview of the causes of diarrhea. In the next video, we'll talk about how to prevent diarrheal illnesses and how doctors treat them. Please leave your comments below, and I'd like to thank you for watching. Thank you.